Hello everyone, this is part 3 of the low-dose allergen therapy Q&A. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And also, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So if you're just tuning into this Q&A, this is part 3. Part 1, to kind of go over what the heck is LDA, answer some questions. Part 2, answers another question, and then here's the final installment here. Someone submitted a few questions, so couldn't get it all done in one video, so here's the third and final installment. So the question is, would yeast LDI, and LDI stands for low-dose immunotherapy, which is very, very similar to low-dose allergen therapy. So would yeast LDI flare symptoms include exacerbation in fatigue, brain fog, and joint pain? So just for the quick clarification, so low-dose immunotherapy typically refers to using formulas that are just different than the food mix, the environmental mix, and the chemical mix that I mentioned in the earlier video about. That's what we use in low-dose allergen therapy. With low-dose immunotherapy, the formulas are typically formulas for different microbes. So say the strep formula, the Borrelia formula, the Bartonella formula, the Epstein-Barr virus formula, or there might be other substances like hormones, so like the estrogen formula, progesterone formula, testosterone formula. And then there are other kind of miscellaneous formulas like to certain, let's say other hormones, for example, or the glyphosate LDI or mycotoxin LDI or certain things like that. So there's different kind of more niche formulas there. But the principles of like how the LDI works, it's the same principles as how the LDA works. It's just different formulas. It's kind of a semantics thing. It's pretty much all the same therapy, just different formulas. So the question, just to kind of flesh that out a little bit more, is that with low-dose immunotherapy, it's a little bit different than the low-dose allergen therapy in that it's more likely, if you will, that we could see flare-up symptoms when a dosage is too strong for what we're working with. With low-dose allergen therapy, we're generally using that for getting rid of or helping to improve at least allergies or sensitivities to foods and things in the environment and chemicals and whatnot. Now, there are patients who are having, full-blown, notable chronic systemic symptoms like fatigue and brain fog and muscle and joint pain and things like that, LDA formulas like to foods and environmental factors and chemicals can certainly benefit from. So it's not just for allergies or just for sensitivities in kind of the more traditional sense, but generally that's what it's for. With low-dose immunotherapy, if we're using, say, yeast LDI or strep LDI or Borrelia LDI, those are formulas that would typically be used for more of these, like classically for more of these systemic symptoms like pain and fatigue and brain fog and other neurological symptoms and whatnot. So because it's kind of a different playing field or different symptoms that we're going after, different kind of pathophysiology that we're targeting, not just kind of like, oh, there's an immune system reaction happening in my nose or my throat or on my skin, but rather like there could be an inflammatory reaction happening throughout the entire body. There is a greater preponderance for flare-up symptoms. And so in part 2, there's a question around kind of flare-up symptoms, kind of predicting whether the therapy might work. The same type of thing is, I would argue, quite a bit more commonly true or quite a bit more commonly the case with the low-dose immunotherapy formulas like yeast or strep or Borrelia or whatnot. To answer the question now with that backdrop in place, so if there were LDI flare symptoms that we might be expecting. In other words, okay, if you flare from a formula because it's too strong, but then a lower dose that's tolerated would be quite likely to help in most cases. Kind of get into that in more detail in video 2 as well. But the question is, well, would the types of symptoms that we would be expecting to see from a yeast LDI should a flare occur, would it be fatigue, brain fog, and joint pain? Or putting it another way, what types of symptoms would we expect to see with a yeast LDI flare? So it certainly could be fatigue, could be brain fog, could be joint pain. It could really be like the way to think about, well, in what way could LDI cause a flare? The question would be, well, where does yeast live in the body? Bearing in mind that yeast is a natural part of our internal ecosystem. It naturally occurs in the sinuses, on the skin, in the mouth, in the throat, in the intestinal tract, in the vaginal canal. There's some argument to be made that maybe it's a natural component of the of our bladder lining as well, and so it can live in many locations. And so if it's if the immune system is hypersensitized to the yeast, if there's essentially a allergy or sensitivity to the yeast, then any or all of those locations could experience inflammatory symptoms. So if the dose is too high, those inflammatory symptoms could get worse. So yes, if it's kind of a systemic, if there's reactivity to the yeast and that's causing a bunch of inflammatory cytokines. Oh no, my computer's dying here, but don't think I need it. So if it dies, it dies. Then that could cause just general fatigue. Or if there were inflammatory cytokines related to the yeast and that was, getting into a person's joint space, getting too high of a dose of yeast LDI could cause an inflammation of joint pain, or exacerbation, I should say, of joint pain or brain fog. But it could also lead to flare-up symptoms in those locations where yeast naturally resides. So it could potentially cause gastrointestinal flare-up symptoms. So it could cause, more gas and bloating. It could cause diarrhea. It could potentially cause constipation, could potentially cause heartburn or reflux, could also cause sinus symptoms. So it could be, runny nose, could be sinus pain, could be potentially headaches as related to the sinuses being more inflamed. I don't think I've ever had a case where it caused any mouth inflammation symptoms with a flare-up, but that's a possibility. And then every once in a while, not very often, it can cause some vaginal symptoms. So can cause some vaginal irritation or itching or whatnot. So it is, and then maybe on rare occasion, I may have seen a couple of cases where it caused some bladder irritation, but I don't think I've maybe seen that a couple of times. Hard to remember all the cases. I've recommended, tens of thousands of doses of LDI over time, so it's kind of can't remember all the exact details, but if there are any bladder flare-ups, it's been pretty few and far between. So it could be more symptoms than just fatigue, brain fog, and joint pain, but those would be certainly symptoms to potentially look out for. The general rule with LDI, if we're talking about folks who are dealing with more sort of systemic chronic issues, is that with any LDI formula, it could potentially cause a flare-up of any pre-existing symptom. So whether it's strep LDI, EBV LDI, estrogen LDI, whatever it happens to be, if a person has pre-existing fatigue, there could be an exacerbation of that fatigue if the dose is too high. With that being said, for a lot of LDI formulas, they have sort of track records that make it more or less likely that they might cause certain symptoms to flare. So, for example, I can think of very few cases where estrogen LDI caused fatigue to flare up. Have I seen it flare up some menstrual parameters? Yep, I've seen that before. Have I seen it flare headaches or migraines sometimes? Yep, I've seen that before, but quite rare, I would say, to see it flare up, say joint pain or fatigue or whatnot. With yeast LDI, I've seen it flare up pretty much everything under the sun. Yeast LDI is one of the most heavy hitting is not quite the right word, because all the LDIs have the same kind of potency to them. I would say that yeast LDI tends to be a very impactful formula. So it's there's many LDI formulas out there, and some of them hardly ever work for anyone. Yeast LDI is one that is a fairly common formula that is successful, meaning which from that I extrapolate that yeast sensitivity is a relatively common thing, but it can be quite impactful on a lot of systems in the body. The good news being that if a person does have a yeast sensitivity and they take the yeast LDI, it can really help with a lot of symptoms. So that's kind of the double-edged sword to that kind of broad applicability of the yeast LDI. So thank you for submitting those questions. It was fun to do a little impromptu LDI Q&A series, so happy to do that. So thanks for submitting the questions, and so I hope this was helpful. If anybody has any questions or comments on this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.